everyone, my name is Lou James, the founder of Pink and Steel International. I am passionate about helping people live as fully and actively as possible after a cancer diagnosis. I'm a cancer rehab physiotherapist and have seen firsthand the physical and emotional effects cancer and the treatments can have on the lives of people affected and those close to them. I am now fortunate to work with and teach a growing number of Pink and Steel cancer rehab physios around the world. They are all making a big difference to the lives of the people they support. One key thing I have learnt working in this field is that people need support through many stages of their treatment and recovery. They need support during treatment and they also need support after treatment. They often need help to cope with ongoing challenges, sometimes years after their initial diagnosis. It is therefore really important if you've been diagnosed with cancer that you do seek support and you don't just struggle on your own. Today I'm going to talk about essential recovery steps which I believe are important to helping you move over cancer. The good news is that more people are surviving a cancer diagnosis. However, what worries me is that many people are suffering unnecessary physical decline. Rehabilitation is an extremely important part of cancer care. Along with the best medical treatment, you also need the best physical rehab treatment available. If people don't get rehabilitated properly after cancer, it can affect their ability to work, their families, their physical, emotional and social well-being, their long-term health and ultimately their survival. The good news is your window for rehab has not closed. You can still get the benefits of individualised rehab whether you are currently receiving cancer treatment or are many years down the track. Now the first point I want to make here is that individualised care is essential first. It doesn't matter how long it has been since your diagnosis, individual care is essential first. Every single person's cancer is different, even those diagnosed as the same type and stage. People respond very differently to treatment and need individualised rehabilitation to suit them. So burning mental cycles by speculating and comparing your situation to others is a waste of time and energy. Now this slide shows the Pink and Steel tiered cancer rehabilitation model. You will notice that this model is opposite to the education model, which starts with larger groups and then works towards smaller groups if people have a learning difficulty. People affected by cancer need individual programming with a qualified medical professional first to assess the effects of the treatment on them and then to tailor a rehab program for their specific needs and goals. I developed the Pink program in 2005 for this specific reason, to help women diagnosed with cancer through individualised prescribed rehabilitation. However, individual care typically needs to flow into further supportive programming. And as mentioned earlier, this is because people need support long after their treatment has been completed. The next tier of interventions is small group exercise programs. And I've developed two small group programs for people after cancer treatment. Now one is called Next Steps, which incorporates Pilates, yoga and cardio exercises. And one is based on the water called Paddle On, where we work on improving balance, core strength and stamina in a very therapeutic environment on the water. So after completion of one or both of these programs, women are encouraged to then get involved in community events, which is Tier 3. We see many wonderful examples of women with cancer going through this tiered program and then joining back to sport or public events. And it is so rewarding to be involved in all phases of the program, to see women getting back to doing the things they love and also helping others that come after them. Tip 1. My first essential recovery tip is to get the best medical advice and to listen to your rehabilitation medical professionals, not Dr. Google. There is a huge amount of information on cancer on the internet. If you Google cancer, you can get 671 million results in half a second. Unfortunately, there is so much information out there now, and some of this information is misleading. It can take a long time to trust your body after a cancer diagnosis, and you may worry about every little symptom, pain or bruise, meaning the cancer has come back. However, instead of letting your fingers do the walking on the internet, it is best to get these checked out by either your physiotherapist or doctor early. My next tip, tip 2, is to get a physical and functional assessment with a certified cancer rehab physio or occupational therapist. So all cancer treatments have an impact on your body, and you should get screened after each treatment so that you know exactly how to maximize your own recovery. Once you've had the assessment, your physio will be able to advise you on what you can do to overcome some of the impact that the treatments are having on your body. It is empowering to be proactive and take control of the things you can control. Addressing signs and symptoms early can also save a lot of time and money later, improve your recovery time, and prevent long-term problems. Many symptoms that are common to women undergoing breast cancer treatment, like cording, lymphedema, shoulder problems, can all be treated much easier if they are picked up early. You may not have visible signs, but getting an assessment early will help you to avoid some symptoms and problems happening in the first place. So tip 2 is to get a physical assessment from a cancer rehab health professional. Tip 3, learn to ask for and accept help. You can pay it forward later. Cancer rehab physio will guide you on what activities, housework or exercise you can safely do, and what you should ask for help with while your body is recovering from surgery or during and after treatment. For example, it may not be a good idea for you to do overhead activities, like hanging the washing on the line, until your body has healed from surgery. This is a great practical job that your friends and family may be able to help you with while you are healing. There is only so many frozen lasagnas you can fit in your freezer, so giving people a practical way of helping you is win-win for you and them. Also, if you are receiving chemotherapy or radiation therapy, you need to make sure you are saving your energy for activities that will help your body heal and feel better. It is far better to use your energy to go for a short walk in the morning than use up all your energy doing the supermarket shopping. This is one time in your life where it is important to make you a priority. Self-care is not selfish or a luxury. It's a necessity for you right now. Remember to save your energy for the activities that will help your body heal and feel better. Try to be patient and treat yourself gently. Tip 4, learn to breathe properly. Breathing is subject to major disruption or interference from thinking, feeling and experience, and also as a result of biomechanical and biochemical factors. It takes a huge amount of emotional energy to cope with a cancer diagnosis. This often disrupts normal breathing patterns, which can in turn make it more difficult to relax, sleep well, and cope with treatment. Being able to relax and to sleep well are so important, and breathing correctly is absolutely essential step in your recovery. A cancer rehab or breathing works physio can teach you how to breathe better again. You may find you've been holding your breath and tensing your muscles without even realizing it. So we say, when in doubt, breathe out. Firstly, breathe in through your nose and out through your mouth with your jaw relaxed. You want to try and direct your breath to the belly without using the upper chest, allowing your body to breathe out fully. Relaxing your shoulders, face and jaw, even just for a few breaths. This can help you find a sense of calm. Learning to breathe correctly is a crucial step in your recovery. Tip 5, avoid inactivity. It cannot be stressed enough how important physical activity is to people affected by cancer. It needs to be understood that while surviving cancer itself is a difficult journey, suffering from additional complications related to inactivity can make recovery more difficult, can affect cancer survival itself, and can lead to serious lifelong complications. It doesn't take long to become deconditioned, and as they say, motion is lotion, so it really is important to move your body. It doesn't need to be long exercise sessions. Short regular walks of just 10 minutes can help. If you're avoiding moving any part of your body due to pain, stiffness, fear, then it is essential you see a cancer rehab physio for a physical assessment. Remember tip 2? So they can get you moving safely again. Many of our pink and steel cancer rehab physios use Pilates equipment to get their patients moving without pain. The bonus here is you can even exercise lying down. There is a piece of Pilates equipment called the Reformer, and many of my clients love exercising on this during chemo and after There are just so many adaptations to exercises to help you move freely again. It may be different to what you've done before, but it will feel good to move. So remember, motion is lotion and avoid inactivity. Tip 6. Be proactive about doing things to decrease stress. There is no way to navigate a cancer diagnosis without a huge amount of stress. Much of the stress that goes along with a cancer diagnosis is related to the uncertainty that accompanies it. Too much stress can make you feel emotionally battered. Being proactive about doing things that decrease stress is the best way to manage it. Now, we know things like meditation and exercise can help. There's also a great deal of research now supporting relaxation techniques, mindfulness, yoga, meditation and physical activity to help. So stress can also be greatly reduced when we increase our social and emotional connections. So put simply, together we're better. So try to schedule in time to do something you enjoy with the people you love each week. If stress, anxiety or depression do become overwhelming for you, make sure you talk to someone and seek professional support as well. Tip 7. Let go of the unimportant and seek help for fatigue. Fatigue is being tired physically, mentally and emotionally, and it is the most common side effect of cancer treatment. If some days you're feeling like you just can't get out of bed, rest assured you're not alone. Cancer-related fatigue can last for months to years after treatment. It is important that you seek support, as if left untreated, it will severely impact your quality of life. Some signs of cancer-related fatigue are prolonged extreme tiredness after an activity, feeling weak, tired, weary or exhausted even after sleeping, being too tired to complete normal everyday activities, and having trouble concentrating, thinking clearly or remembering. Or if you're spending more time in bed or sleeping. So some strategies to help you manage fatigue are rest, but not too much. Establish good nighttime sleeping patterns and take short naps rather than one big long rest during the day, as too much rest can decrease your energy levels. And it's important to stay active. Regular moderate exercise has been shown to ease symptoms of fatigue. It's important that you pace your exercise, and keep an exercise diary can help. Save your energy, prioritize your day and plan ahead. And take rests when needed, and don't push yourself too hard to fit too much into your day. So cancer-related fatigue is manageable with help. Staying active and incorporating exercise into your lifestyle is the best way to help replenish your energy levels. So talk to a Pinkelstein physio, as a cancer-related fatigue is manageable with help. It is important to try not to overtax yourself by trying to fit too much into your day. You need to let go of the unimportant and delegate when you can. Tip 8. Prioritize exercise each week like your life depends on it. The pile of research supporting exercise for people affected by cancer is undeniable. On the 27th of May 2017, a review of more than 100 studies involving tens of thousands of cancer patients worldwide, published in the American Journal of Epidemiology, found mortality rates among those who regularly exercised fell up to 44%. The risk of cancer recurrence also dropped to 33%, and the side effects of chemotherapy reduced. Unfortunately, it has also been published that less than 13% of women with breast cancer achieve the recommended 150 minutes per week of physical activity. So are you hitting this target? Are you managing to achieve 150 minutes of moderate intensity physical activity a week? And also, are you including 2 to 3 resistance workouts? If you aren't hitting these targets, you should seek support to help you incorporate more activity into your week. Improving your stamina and fitness can be a catalyst to move your life in a more positive direction, regardless of what you've gone through. The type, intensity and duration of activity should be prescribed by a cancer rehab health professional to safely and effectively manage your return to fitness. Exercise is a priority, but it needs to invigorate you, not wear you out. It also needs to be something that you enjoy. Exercise is not necessarily done under fluorescent lights at the gym. There are plenty of different ways to move your body to give you health benefits, like dancing, paddleboarding, walking, etc. So how do you fit in the recommended 150 minutes of moderate physical activity per week? Well, this is the aim. You may need to work up to achieving this. So aim for 60 minutes per week, maybe more realistic to start with. And you can also break it down to smaller, more manageable sessions. For example, 10 minutes 3 times a day, 5 days a week is 150 minutes, or you could do 30 minutes 5 times a week. It is also really important to add some resistance exercises in your weekly routine. Now this doesn't have to be at the gym. There are lots of Pilates exercises, body weight exercises or home-based exercises that you can do to increase your strength. So remember, exercise is important for every system in your body, including your heart, bones and brain, and can help you manage weight. It really is a wonder drug, and if it were a pill, everyone would be taking it. Tip 9, stay connected and stay motivated. Going through cancer treatment can be a very isolating experience. The importance of a community that just gets it can't be overstated. Joining in with a group exercise program like Next Steps or Paddle On, or others that you may have in your area, bring people recovering from cancer together, and the bonds they make form a very important support network going forward. This is where Tier 2 programs from our Pink and Steel rehab model fit in, and also wellness programs in your community can be a very effective way in keeping you motivated to look after yourself and provide support. Data we have collected from our group exercise programs shows the importance of social support and connections from other people that understand what you've been through. It is just fantastic to see people supporting each other and having fun. Tip 10, get some green. Studies have shown that getting outside and reconnecting with nature can help lift depression, improve energy and boost well-being and mental health. Spending even just 20 minutes outside per day could boost energy levels and give you a greater sense of vitality. Now, I'm a real outdoor enthusiast. Whether it's being in my garden or walking in the bush, I fully support what the research says and how beneficial it is for your well-being. So for my last tip, set small goals and celebrate your wins. Focusing forward and setting small goals in your recovery is really helpful to appreciate how far you've come and to give you strength to keep going. Taking the first step to write down a goal gives you something to strive towards, as well as look forward to. The sense of accomplishment that comes from achieving your goals can feel very empowering, satisfying and healing. I think that celebrating the smaller things is an important habit in living life to the fullest. We need to remember to celebrate more often, not just the big accomplishments, but all the small victories in our lives as well. So don't forget to celebrate each little win you have on your road to recovery. I'm now going to let Isabel tell her recovery story about going through breast cancer treatment and the little goals which turned into bigger goals she set to help her move over cancer.
My tumour was large. It had already spread to my left armpit lymph nodes, in which case they were very keen for surgery first, followed up by chemotherapy and then radiation therapy to follow after that to really knock it on the head. There are side effects from surgery involving scarring, pain, nerve pain, numbness, a restricted range of motion. I struggled with that in the early stages in particular, and I developed lymphedema quite early on from the removal of the lymph nodes, and that's where Pink and Steel had particular specialist knowledge that has helped me deal with this, because it's not going to go away. I have to keep on top of this every day. The chemotherapy side effects were pretty horrendous. I don't actually even like to think back on how bad it got. You don't realise literally how beaten down you can get through all that treatment. I was definitely tipped forward, shrunken, tired, and the surge of energy you can get just from somebody noticing that, hey, you are tired, you've bent forward, your muscles have given up on you. Let's get back into something small, regular, little bits at a time, one step at a time, and you start to stand up, see the world again, full face on instead of always looking down. And then you realise, oh, yeah, actually my shoulders don't hurt so much now. And my arm doesn't hurt so much. These were things that these physios know about, but sadly it didn't seem to be something that I was going to get from the publicly funded health system. The Pink and Steel physio program is a 10 out of 10. for me. Not just on the physical side though, and I think this is really important. Where I was really struggling was with self-confidence. I had been quite an active person. For me, being that knackered was unusual. And I was just, didn't know what to do, where to start. I was so scared of everything. I mean, I didn't want to undo the treatment. I didn't want to do something that might harm me, but I didn't know what to do. And so the relief to find somebody who knew exactly A, what that felt like, and B, what to do about it. Pink and Steel had been such a revelation to me, and I set myself the goal, yeah, I will ride my bike up the Coronet Peak Ski Field Road. I guess it was an 8-month to 9-month trip from very tentative steps. I hadn't been on a bike for 5 years. I was wobbly and weak and I couldn't ride in a straight line, and I was really emotional about the whole deal. We made all our training adventures. It started off with walking up a lot of hills and just cycling on the flat. Then we'd cycle a bit longer on the flat and I'd walk more hills and longer hills and higher hills. So we came to D-Day, trucked up to the bottom of Coronet Peak, unshipped the bike off the back of the car, just hopped on and started pedalling. And yeah, I made it to the top, non-stop, which was my ultimate goal. And I was so thrilled to be able to do it.
In summary, I hope you have found Isabel's story motivational and my essential recovery tips useful. And I wish you every success. Above all, try to remember that even the dark days will pass. Remember, every single person's road to recovery is different. Don't suffer on your own, seek support. There are people who can help and understand the challenges you are going through. Take care of you. All the best. Move over cancer.